short RX lumen allows for maximum aspiration capacity and excellent deliverability. Flexible catheter shaft incorporates unique anti-kinking properties, enabling excellent trackability. Removable core wire provides maximum pushability. Due to the size and shape of the Thrombuster 2 catheter, a double wire technique is possible for more complex interventions. Competition overview. The most common thrombus aspiration catheters available in the European market, the Competitor E, Competitor P, Competitor D, and Competitor F. Tip design. Thrombuster 2 offers a highly favorable crossing profile while maintaining a large round aspiration lumen. Trackability. In an in vitro evaluation model, ASTM 2394 tracking fixture was used to evaluate the trackability performance of Thrombuster 2 compared to other thrombus aspiration catheters. A digital force gauge was installed at the proximal end of the model to record the findings. Competitor E6 French shows a high resistance force when being delivered into the initial tortuous part of the evaluation model. The resistance force drops after the initial turn, but it continues to rise as it advances into the distal part of the evaluation model. With Competitor P6 French, the resistance force consistently rises as it advances into the evaluation model. With Competitor D6 French, resistance force suddenly rises in the middle section of the evaluation model, and it is maintained at a high level throughout. With Competitor F6 French, resistance force rises gradually as it advances toward the distal section of the evaluation model. The overall resistance force is low, however, the catheter insertion is not smooth. With Thrombuster 2 6 French, the resistance force rises gradually as it advances toward the distal section of the evaluation model. It is important to note that Thrombuster 2 has the least amount of resistance force, and the catheter insertion is very smooth in comparison with the other catheters. Thrombuster 2 is the most desirable since it offers the lowest resistance force throughout the tortuous evaluation model and provides an extremely smooth catheter insertion and delivery. It is remarkable that resistance force is maintained at the lowest level and catheter insertion is comparatively very smooth. With the 7 French Competitor E, the resistance force steadily rises and the catheter insertion is difficult. The resistance force for Thrombuster 2 7 French is remarkably low and the catheter insertion is very smooth. Overall, Thrombuster 2 has the best trackability performance with the least amount of resistance force. Thrombuster 2 can be delivered smoothly even in a highly tortuous anatomy. Crossability. In an in vitro evaluation, a stenotic lesion model was installed in the distal section. The crossing performance of each aspiration catheter was measured. A 6 French Competitor P would only cross a minimum stenotic lumen diameter of 1.60 millimeters. A 6 French competitor E would only cross a minimum stenotic lumen diameter of 1.50 millimeters. A 6 French competitor F would only cross a minimum stenotic lumen diameter of 1.50 millimeters. It was noted that multiple kinks were created at the bend. A 6 French competitor D would only cross a minimum stenotic lumen diameter of 1.50 millimeters. It was noted that multiple kinks were created at the bend. Whereas Thrombuster 2 6 French could cross the 1.35 millimeter stenotic lesion model without any kinking. A 7 French competitor E would only cross a minimum stenotic lumen diameter of 1.95 millimeters. It was noted that multiple kinks were created at the bend. Whereas Thrombuster 2 7 French could cross the 1.50 millimeter stenotic model without kinking. Thrombuster 2 demonstrated the best crossing performance of any competitor. Thrombuster 2 7 French proved to have a similar crossing performance to the competitor's 6 French catheters. Kink resistance. The proximal shaft of each of the 6 French catheters was intentionally kinked. The competitor E, competitor P, competitor D, and competitor F aspiration lumens did not recover their shape, whereas the aspiration lumen of Thrombuster 2 recovered. The proximal shaft of the competitor E7 French was intentionally kinked, and the aspiration lumen did not recover, whereas the aspiration lumen shape of Thrombuster 2 7 French was recovered. Thrombuster 2 has superior anti-kinking properties and allows for rapid lumen recovery. This helps to maintain excellent aspiration performance. Double wire technique. When performing more complex interventions, a double wire technique is often required. To make this possible, enough open space must be available within the guide catheter to allow for a second guide wire and the aspiration catheter. A double wire technique is not possible with the competitor P, competitor D aspiration catheter. With Thrombuster 2, competitor E, and competitor F, the double wire technique is possible. However, Thrombuster 2 has the lowest resistance force and the smoothest delivery. As for 7 French, both Thrombuster 2 and competitor E were capable of the double wire technique. However, the resistance force is significantly lower with Thrombuster 2. Amongst all the catheters that were capable of the double wire technique, Thrombuster 2 has shown the lowest resistance force and best wire and catheter maneuverability. Prepping and extraction instructions. Fill the 30 milliliter syringe with 10 cc's of heparinized saline. Connect the syringe to the stopcock and extension tube and flush the heparinized saline until it drips from the distal end. Connect the extension tube to the connector of the core wire, which is pre-installed inside the Thrombuster 2 catheter. Flush the Thrombuster 2 catheter with the remaining heparinized saline that is within the syringe. Close the stopcock to its off position. Attach the flushing needle onto another syringe prepared with heparinized saline and fill the guide wire lumen from the distal tip. Advance the Thrombuster 2 catheter to the target lesion. Disconnect the extension tube, then remove the core wire from the Thrombuster 2 catheter. Reconnect the extension tube to the Thrombuster 2 catheter hub. To generate negative pressure, pull back the plunger all the way on the syringe. Then turn the plunger clockwise to lock it at the desired aspiration volume. Open the stopcock to start aspiration. Pecking motion performs effectively for mass thrombus aspiration. After completing the extraction process, turn the stopcock to the off position and remove the catheter slowly, or attach second syringe and repeat the extraction process. When aspiration is completed, turn the stopcock to the off position and slowly withdraw the Thrombuster 2 catheter. Precautions. Aspirating a thrombus at a bifurcation. If aspirating a thrombus at a bifurcation, take care that the thrombus does not disperse to a lateral branch when removing the catheter during operation or while the thrombus is attached to the end of the catheter. There is a danger that the lateral branch could become embolized. Inserting and removing the catheter. Insert and remove the Thrombuster 2 catheter slowly and carefully. If rapid insertion or removal occurs, there is a potential risk that the catheter may develop a kink or that the lumen of the guide wire could break. Sudden movement, especially when removing the catheter, may cause the guide wire to become looped within the blood vessel or to get caught on the end of the guiding catheter. Removing the catheter. Remove the Thrombuster 2 catheter slowly, taking care that the angle between the guide wire and the catheter does not open too wide. If this happens, there is a potential risk that the catheter's guide wire lumen may break. Instructions for use.